Absolutely delighted that we had today the 5th launch event of our book Making Health and Social Care Personal and Local, moving from mass production to co-production, and again we had lots of authors with us showing that now co-production is no longer just a nice idea, but it's now actually being taken serious and being rolled out in councils. The purpose of the book is to provide people with stories, with testimonials, but also with hard evidence that co-production isn't just a good idea, but it's something which is happening already and which is very clearly producing much better results than traditional forms of public service delivery.
Today I've been talking about our website My Care My Choice, which was co-produced with customers, stakeholders, about 4 years ago, and we wanted today to share our experience with partners and colleagues, share a bit more about the chapter of the book, about the impact it's had locally on how we've redesigned our services and information systems on the back of using My Care My Choice website as our vehicle to promote choice and control.
So why did you have to redesign My Care My Choice?
Because our previous website was so difficult to understand and navigate that people spent up to 45 minutes trying to find basic information about social care. We knew that it wasn't working for a lot of people, so basically we work with customers who are the end users of our information resource to basically redesign the way that they want information to be presented in a sort of accessible, bright, colourful way, which isn't about social care being the place of last resort, which was what it was perceived of by many people that we work with. You can see it on mycaremychoice.org. Hopefully I've got the web address right, but we'll put that on anyway. There'll be a link hopefully on this blog so people can see that.
I was looking at whether increased involvement in the health service could lead to co-production. I think there's a lot of possibilities, particularly if we're going to deal with a lot of the health problems we face, some of which are a result of bad lifestyles. Some of them are looking after elderly people who have long-term conditions. You can't do these unless the whole community is involved.
I was talking about the importance of co-production as something which needs to involve professional staff, organisations, health and social care organisations, as well as communities themselves, and how co-production is about, in a sense, refashioning the relationship between organisations and the public they serve. Well, I think the benefits are that you have in all communities a level of social capital, a level of community capital, a level of potential engagement and support and networks for people who are otherwise going to be at the margins, and we can use that capital to support those individuals as part of their care and support processes. I mean, I think it's not just about the receipt of care. It's about connecting people also who have care needs into communities because they too are citizens and contribute to them.
Catalyst aims to ensure that there's great local services for local people that are sustainable, of high quality, and we believe that if we harness the talents and gifts of individuals in those communities, then actually they're the very people that will support people in those communities the best. We work with local authorities, health agencies to support what we call micro providers in those areas. A micro provider is one that's got 5 or less full-time equivalent staff that's totally independent of a larger organisation, and they deliver a broad range of services around health and social care, but in the broadest sense. So we've got Funky Fitness and Fun. Karita is a shared lives carer who twice a week runs a fitness session for people with a learning disability. Those members tell her what they want, what activities they want to achieve, and she commissions it in future sessions. We also have services that are delivered by people with a disability themselves. So Dance Syndrome is run by Jenny Blackwell. Lots of support from her mum. She had a passion for dancing, and she now works alongside other non-disabled dancers to deliver workshops for people with a learning disability. We see the outcomes for people are massive. I mean, some people might not deliver, if they've got a disability, may not deliver a service on a commercial basis, and we've coined the term the entrepreneurial volunteer. So they may never come off those benefits or in the medium term, but actually what it does for their self-esteem, the confidence, it's difficult to kind of explain really, and they bring other people along on that journey as well and give great examples to people. So we're starting to look at people, and we need to not have users of services with needs, but actually assets. And I think once we start treating people differently, not labelling people carer, user, then the communities around the country will be a better place.
And there's been a lot of buzz. We've had really good feedback from people who've been here about it, food for thought, the best 2 hours somebody's spent in a long time. And I'm really pleased that Stockport hosted this and has got real benefits out of it in terms of networking with people and having a really lively debate today.